She serves as the strategic clinical lead at ITEC in Ukraine. Joining her is her colleague Alyona Ihnatiuk, who is the strategic information lead at ITEC Ukraine. And her work focuses on developing public health interventions, monitoring and evaluation system frameworks, data analysis, and program evaluation. So I will turn it over to our colleagues.
Hi, everyone. I just wanted to make one quick announcement that if you have a question, to use the Q&A box, and we'll be addressing those after the talk. Thank you.
Thanks. Thanks, Lydia. Dear colleagues, oh. First of all, actually, we would like to thank each of you for your interest in Ukraine and support in such a difficult time of war in Ukraine. During our today's meeting, we will talk about the impact of war on the life of Ukrainians, the resilience of the healthcare system, and actually exact input of ITEC program. Yeah, next slide, please. So very briefly about Ukraine's background. Ukraine locates in Eastern Europe, is the second largest on the continent. And as of 2021, the population of Ukraine was 41.6 million of people. Next slide, please. For 8 years, until February 2022, the hybrid phase of Russia war against Ukraine lasted, during which the Russian military and political leadership officially denied the Russian Federation's involvement in hostilities on the territory of Ukraine. Russia began its armed aggression against Ukraine on February 20, 2014, when its troops invaded the territory of Crimean Peninsula. In April 2014, Russia occupied part of the Donetsk and Lugansk Oblast, and you can see on the left map rounded in black. And after its full-scale invasion by March 2022, almost 27% of Ukrainian territory was occupied. Thanks to Ukrainian armed forces and international support, Ukraine was able to liberate a part of its territory. As of the end of 2023, 18% of Ukrainian territory is temporarily occupied by Russia. According to the Ministry of Defense, as of February 2024, the front line was almost 2,000 miles long. As you can see on the map, explosions and remote violence are happening in all regions of Ukraine. So there is no safe place in Ukraine. Next slide, please. That was 2 years of terror. Since February 2022, officially, it was registered 86,700 events of hostilities were recorded. But I would like to underline that it was officially. About 6,000 violent events targeting civilians, more than 1,500 attacks on healthcare facilities, which do not include the number of those who had like broken glasses. So it means that some kind of structure руйнування. with destruction, sorry, just forgot what. Yeah, structural destructions. And about 9,000 air and drone strikes against civilian. So these numbers do not counted those strikes that are happening on the front line. Next slide, please. And at the first picture, you can see how nowadays the airspace in Europe looks like. At a time when the rest of Europe has civilian aviation highlighted in yellow in their sky, Ukraine's sky are full of drones and missiles. Next slide, please. Since February 2022, Russia is persistently attacking our critical infrastructure. As for now, Ukraine's energy system has lost 50% of its capacity. All regions of Ukraine experience power outages daily. Electricity outages impacts mobile and internet connection, water supply, and heating. Health facilities experience blackouts with problematic access to e-registers and laboratory equipment. In recent weeks, Russia has intensified its drone and missile attacks. For example, last Friday, March 2022, Russia launched 60 drones and 90 missiles in a very short period of time. Our air defenders were able to shut down 55 drones and only 37 missiles. As a result, 6 power plants were damaged, locating in different regions of Ukraine. 10 regions experienced continuous power outage. Some of them still has energy blackouts. Additionally, debris, and I would like to add that debris from downed missiles or drones also poses a destructive threat when they fall on civilian infrastructure. For instance, last year on May, one of Iran drone was downed by air forces, but its debris fall down on the roof of my building and caused destruction of part of its roof and apartments of the building. But thanks God, nobody was killed. Next slide, please. On this picture, you can see the one of the city, that is Kharkiv city, which is located in the northern east of Ukraine. The city with population of more than 1 million people. And also you can see the picture of destruction of a combined heat and power plant, which was used for supply this city with energy and heating. So such destruction of the heating and power plant is very difficult to restore due to the destruction of unique equipment. Thus, people are left without electricity and internet, and it is not known how long it will take to restore power supply. Next slide, please. So in another region of Ukraine, Dnipro hydroelectric power plant and its dam were hit. Actually, the Dnipro hydroelectric power plant is the largest one in Ukraine. The potential consequences of such an attack could be catastrophic, such as the destruction of the Kakhovka hydroelectric dam as a result of its explosion by the Russians on June 2023. Next slide, please. And here I would like to very brief to describe. This is a map of Ukraine, and in blue you can see the largest river of Ukraine. It's Dnipro, and Dnipro is a cascade of water reservoirs. Man-made structures had controlled the river's flow for decades before the dam destruction in Kakhovka. So the The Kakhovka is circled by red, and a little bit upper under it, you can see the Dnipro reservoir. Next slide, please. When Russian destructed Kakhovka Dam and the hydropower plant, it caused a huge, horrible impact on the on everybody who lived in that area. So more than 80 residential areas were impacted. More than 100,000 people suffered. Massive destruction of residential buildings, a huge destruction of flora and fauna, and of course a lack of water supply of all regions which are located in that area. A powerful water flow swallowed up hundreds of thousands of homes. Many people were blocked without possibility to evacuate. Russians continued to shell the sunken regions, making evacuation impossible, and many people drowned in their homes, mostly elders and women with children. This disaster has put thousands of lives at risk, making the already dire conditions faced by Ukrainian people even worse. Entire villages have been swept away. The farmland has become unusable, and deadly mines are being washed up onto the shores. And also it has huge influence on the health sector and damaged 11 health facilities located in these regions, reduce access to health care for those who live there, interrupted health care, and increase mental health issues. Next slide, please. Talking about the total impact of war on public health in Ukraine, approximately 1.4 billion of dollars in damage was actually estimated to the health sector in Ukraine. 12.5% of healthcare facilities have been partially or fully damaged and destroyed as of the current assessment. And 787 pharmacies damaged and destroyed. But I would like to also highlight that this is not like exact numbers. This is very oriental, like officially registered data. Yeah. Next slide, please. And speaking about the HIV services provided in Ukraine, also our HIV clinics were damaged. And for instance, 12 HIV sites were damaged during 2023. On this slide, you can see the statistics of the functionality of HIV sites in the regions which are located at active combats, at the territory with active combats. And you can see that most healthcare facilities available at these regions are destroyed and non-functional, or are located in occupied territories. Next slide, please. Actually, people in Ukraine continue movements because of active attack. And there are right now 6.5 million of refugees fleeing from Ukraine. And we have 3.7 million internally displaced person in Ukraine. Thousands was killed and injured. Millions lost their homes. Next slide, please. And based on the, according to the World Bank, government of Ukraine European Union and United Nations estimation gross domestic products for 2023 is 74% of 2021 GPT in real terms. 486 billions of US dollar recovery and reconstruction needs, which is 2.8 times the GDP of Ukraine for 2023. Over 10% of the total housing stock either damaged or destroyed. Next slide, please. And the most sensitive crimes against children. Children are the most vulnerable to the horror of war. The children of Ukraine have experienced more than 2 years of violence, trauma, loss, destruction, and displacement since the war began in February 2022. Millions of children have had their birthday celebrations, school memories, and time with friends and family stolen from them. They have lost their homes, schools, and playgrounds, but also parents and relatives. The war is taking away their childhood. Here is a video which was made this week on Monday, March 2022 morning, about 10:30 a.m. Children are running to the bomb shelter during explosions in Kiev in Kiev. Are you ready? Yeah. It was a ballistic missile attack. The horrible thing regarding this kind of missiles is that people do not have enough time to replace themselves and their loved one to the safer place, because it took about 2 minutes from launch of the rockets until it targets for launch in the Black Sea, until it targets some object in the Kiev. And actually our system is not able to fix it and get to know to people that they should go to the safer place. Next slide. Moving to the HIV epidemic in Ukraine, as of the January 2022, there were 216,000 people living with HIV in Ukraine known in Ukraine. Despite war and thanks to heroism of Ukrainian clinicians, the provision of services was not interrupted, and you can also see it on the cascade. Sometimes our providers, medical doctors and nurses bring drugs, tests, and other medical equipment into their homes, shelters, to provide services there, to cover with their patients with that services that they need. Next slide, please. And we come smoothly to the ITech focus in Ukraine and ITech objectives. So ITech started working in Ukraine in 2011 with the provision of support to the Ministry of Health of Ukraine in strengthening national and local healthcare systems. Right now, this year, we have four priorities for objectives. Two are site level, which are focused on the pre-exposure prophylaxis provision, and we directly worked with healthcare facilities. And second site level activity is enhancing mental health support services for healthcare workers and patients of the PrEP program. Third and fourth are more like national one and focus on improving and expanding HIV care and treatment, as well as on continuing professional development and HRH. Next slide, please. We are working in Ukraine in 14 regions, and all our site level activities are implemented at 17 HIV priority sites. Next slide, please. Here you can see that on this slide, the statistics on the enrollment of patients new to using PrEP. We think our program at priority sites, and actually Russian full-scale invasion of Ukraine interrupted the program definitely, and we experienced and found that drastic decrease in enrollment because many of our facilities sites paused providing services or not or were not able to operate in a routine mode because of combat, because of shelling, because of missile attacks. But with support of our program, of our project, and also thanks to the heroism of our clinicians who stayed in places and continued providing services, we could like reach full scale invasion trend, and right now more or less can keep it on the same line. Next slide, please. On this picture, you can see one of our sites damaged on February this year. It's Selidova Central City Hospital. This hospital was targeted second time previous year. Another part of another building of this hospital was destroyed. This year, actually, the rocket targeted especially HIV cabinet, and that's why this is the only one hospital in this city. All staff moved to another city, and as well as actually HIV services. That is why people living in this area right now experience issues with access to healthcare. Next slide, please. Speaking about the key population of PrEP program, the majority of group is men who have sex with men, about 40%, 20% people who inject drugs, 2.5% female sex workers, only 3 transgenders are involved into the project, and non-KP population is of about 40%, which includes discordant couples and those who practice risk heterosexual behavior. Next slide, please. Ukraine faced with shortage of medical staff. People moved to safer region and left like their workplace for another specialist. We think our program to ensure sustainability of services with donor support. We last year we launched two additional model. We engaged family doctor to PrEP provision and STI doctor to PrEP services provision. Because like historically, like the more broader model which is used in Ukraine is when infectious disease doctor provide PrEP as well as RT services at HIV clinic. But we could diversify PrEP service delivery, and actually this way could ensure its sustainability and of course improve access to care for those who need the services. Next slide, please. Speaking about our second objective, which is new for us, but very important, taking current circumstances, mental health services for PrEP. So we think our program, starting from this project year, we started to implement services for both providers as well as for PrEP patients, because everybody are living in a VAR condition, and everybody needs mental health support services. For PrEP patients, we added like one more service to the package of PrEP provider, which is screening for depression. And during 5 months of project implementation, more than about 268 PrEP patients were screened, and like sites of depression were identified. These persons were referred to psychiatrics to receive medical care. So 8.3% of the total population were identified as sites of depression. Next slide, please. And regarding the services we offer to PrEP providers, we think our project, so this is like a CPD online series on trauma and its effects, online training on screening for depression, and also training on mental health support. Also, our team of counselors conduct professional supervision session and psychological support and counseling to each PrEP provider engaged into our program. Next slide, please. We received really good feedback from our providers and from patients, and everyone also voiced the need to continue these activities. And with the support of the headquarters and from donor HRSA, we expect expansion of these activities next year. And also we will include into our focus additional key groups. It's military and families of the military. Next slide, please. Yeah, and actually, why military? These people experience really hard times, and we plan to provide services to those who were injured, to those who were demobilized, and also to those who were prisoners of war. This week, the United Nations Human Rights Monitoring Mission in Ukraine published the report on the human rights situation with detailed findings from interviews with 60 recently released Ukrainian prisoners of war. Almost every single one of the Ukrainian prisoners of war described how Russian surveillance of officials tortured them during their captivity, using repeated beatings, electric shocks, threat of execution, prolonged stress positions, and mock execution. Over half of them were subjected to sexual violence. Most prisoners of war also recounted the anguish of not being allowed to communicate with their families and being deprived of adequate food and medical attention. And on this slide, you can see the pictures of our defenders who released from Russian captivity. And you can see on the first picture, Mikhailo Dianov, before and after Russian captivity. The third picture show how the Ukrainian soldier just released from Ukrainian or from Russia captivity cries while eating apple because they were not had an opportunity to have very basic things that human need in everyday life. And the last picture show the demonstration of families of the military in support of Azovstal defenders who more than 2 years, about 2 years, are still in Russian captivity and go through all these tortures. Next slide, please. Also, on the national level, our team members support Ukrainian government and actually Ministry of Health of Ukraine in improving and expanding HIV care and treatment nationally. So mostly participate in development of medical and technical documents like SOPs and guidelines. Next slide, please. Conduct activities regarding improving human resources for health, which include in-person and online training events, development of distance learning courses in cooperation with the Public Health Center of Ministry of Health, and monthly online CPD session facilitated by international experts. Next slide, please. So the core target audience for our CPD sessions are infectious disease doctor and dermatovenerologist, that means STI physicians, primary care physicians, pediatricians, and social workers. But all the time we are open and we can receive anytime requests from the Ministry of Health and react on that and provide like educational sessions to those who need and who were identified by the Ministry of Health. Next slide, please. Core topics for our CPD webinars are more related to HIV prevention, treatment, and care, but also mental health as our like a new component, which we will expand in next periods. Thanks. Or next slide, please. And every year our team develop distance learning courses which are uploaded into the CPD platform of the Public Health Center of the Ministry of Health of Ukraine. And actually these training courses are distance learning courses are available for any medical provider in Ukraine, and yeah, anyone can take it. Also, they are mostly related to the HIV services, but also we think the previous project year, our team developed distance learning course on providing psychological, next slide please, on psychological support to people living with HIV during wartime in Ukraine. 2 national experts and 3 local experts collaborated and developed this course for healthcare workers of facilities that provide services for people living with HIV. And mostly this course is focused on recognizing trauma, self-care in psychological distress related to trauma, psychological collegial support, and provision of trauma-informed care of people living with HIV. Next slide, please. Challenges and needs. No one slide will could include all challenges and needs which are existed and which Ukraine is faced right now. But here we listed more that are related into for our work, for our program, and actually for healthcare. It's a damaged infrastructure and healthcare facilities, limited or absence of telephone and internet connection, electricity, active hostilities, areas, damaged energy grid. Also, another one is healthcare worker outflow and staff shortages, extreme workload on healthcare worker who stayed in place of their work, lack of state capacity to fully fund the HIV prevention, treatment, and care program. That is why it's extremely important for Ukraine to receive like international support to make the services stable, because before war, during a long time, many efforts was made and really good results were achieved. And only with this support right now, we are able to keep and to manage the HIV epidemic in Ukraine. And also a PrEP program implementation was paused at IRT sites located on temporarily occupied territory until liberation. Next slide, please. And here I would like also to announce that our manuscript on impact of war on HIV-related healthcare services and health workers in Eastern Europe was published and is available, so you can go through that link and read more about experience of healthcare providers engaged into our program. It was a qualitative study, so yeah, welcome. Next slide, please. So thank you so much for your attention. Yeah, we are in support.
We'll now open things up for Q&A in the room or virtually.
First of all, just thank you so much for that presentation. It was just no civil been through and how your team has endured all of this to be able to just maintain your work, but also your lives, and this people experiencing this, our heart really goes out to you. So thank you for sharing today. A question about any changes in service delivery for HIV with the loss of infrastructure of the health facilities? Have you started moving to community-based delivery or mobile delivery, or what are some of the adaptations that you've had to take on for the loss of infrastructure? общаться с пациентами по интернету, по телефону, потому что приходить-то некуда.
Ну, звісно, ситуація вимагала змін.
That situation, of course, required changes.
Були території, і зараз є, і ви бачили, де немає навіть фізично, де розміститися тому ж самому HIV сайту.
Problem, we sometimes hard to find a place where to put HIV site. We need to find some peaceful, safe place to put HIV site.
Але ви також, напевне, помітили, що життя в Україні, воно існує і воно рухається вперед.
Because a lot of things are destroyed in Ukraine.
Зараз багато надбань медичної реформи.
Сейчас очень много медицинских. Right now, a lot of reforms in healthcare.
Як то можливість надавати ВІЛ-послуги лікарям не тільки інфекціоністам, а будь-якої іншої спеціальності.
So right now, because as was said before, a lot of changes in capacity and how many doctors able to provide health, like infectious disease doctors, lack of them. So now other specialty doctors like STI doctors and other doctors trying to do the same job what previous doctor did for HIV patients.
Якщо ближче до вашого запитання, то ми зараз використовуємо той ресурс медичних фахівців, які є в тому чи іншому регіоні, який лишився.
We trying to find all resources which is safe in the region where we're working.
Ми долучаємо сімейних лікарів.
We doing training for the family doctors.
Лікарів, акушерів-гінекологів.
We training OB and gynecological
And no training.
and also
For the service provision. Service. Service provision.
We teaching gynecological and OB doctors to provide PrEP for the patients who seeking attention from them.
І це стало можливим в рамках нашого проєкту. Ми запропонували їм зразу навчання, а потім долучали їх до сервісів і мали такий успіх, як ви бачили на графіках.
We see some success of what achieved since we start to teach them PrEP, how to do PrEP for public.
Також максимально використовуємо потенціал медичних сестер, тому що їх в системі більше, і їх лишилось більше на прифронтових територіях.
Because we have more nurses than doctors, then because we have more civilian nurses and we have more nurses who work in the military fields. We also teaching them, so they also know how to provide PrEP to the population.
І ми доволі гнучкі і відслідковуємо ситуацію в регіонах і підключаємо фахівців, яких можливо нам на даний момент, і які нам потрібні. І таким чином ми зберігаємо HIV сервіс.
So
So we observing and we monitoring the situation in region, and we'll see who is available and have capacity to provide services and teaching them for PrEP, so they can use PrEP for population.
I want to also add one more comment that directly after the full scale invasion, or for those regions who are close to the front line, we observe, as Oksana said, that there are more nurses because clinicians, maybe because of higher income, are able to move to safer regions. Nurses mostly stay at their home places, home cities, and we to ensure the sustainability of the program, we developed some kind of hybrid models when nurse, under the direct instruction from the provider with whom she worked and who moved to another region or abroad, physician conducted consultation and give direct instruction what the nurse should do, like dispense drug, do testing services. So just to keep the service alive and available for patients. But also in some region, healthcare providers do visits like on mobile vans to the regions where healthcare facilities were destroyed and services are not available.
I agree with Pam. This is just remarkable work, particularly despite the circumstances. I had a question about the mental health, the workforce providing the mental health services. I think you mentioned that in the current services are psychologists are providing the counseling, but just in thinking about scaling, can you speak a little bit about will there be enough psychologists? What other kinds of disciplines and PrEP sites or HIV care and treatment sites could be involved in providing mental health services?
Специалистов в данном регионе, то есть есть недостаток специалистов для как в дальнейшем вы собираетесь использовать психиатров для того, чтобы они помогали пациентам?
Ну, сказати, що в нас вистачає фахівців будь-яких і будь-де, ну це напевно ні.
We don't have enough specialty doctors, and we don't have enough psychiatric and psychological services in the area.
Лікарі також люди, вони воюють, вони на фронтах, ви бачили, яка міграція в нас.
For two big reasons, we don't have enough specialty and doctors in the area, because all doctors also people, and they also have military obligations, and they also on the battles with other soldiers. Another big reason why we don't have enough providers, because immigration. So everyone, a lot of people want just go to the safer place with family, and for some people, family more important than.
Тому особливо в прифронтових регіонах ми використовуємо весь медичний ресурс, який можна задіяти.
For us is priority to put all providers and specialty doctors to the soldiers, to the places where actually battles, to provide services for the military. civilian kind of have luck right now of the medical providers?
В рамках програми з ментального здоров'я до навчань ми залучаємо лікарів, медсестер і незалежно від фаху, від спеціалізації.
Right now we're trying to fix lack of psychiatrical services in the area by teaching just regular doctors, regular nurses, and other medical providers how to provide basic psychiatrical services.
І ми вчора обговорювали цю проблему з Крістен і з Мішель.
Yesterday, we discussed our problems with psychiatric conduction with Michelle and Kristen. They are international specialists in this area, and
І вони нас запевнили, що ми на правильному шляху, тому що питання скринінгу – це питання будь-якого медичного.
And they told us that we are doing right things because we want to do screening, basic screening, teaching our doctors how to do basic screening for mental symptoms, like for depression, anxiety, or post-traumatic syndromes. So nurses learning how to basically screen all these people who coming for other reasons for the medical attention, and that will be big help to understand needs in the mental health of population, and then when we will know who needs these services, we will provide services for them, because not everyone able to go to the psychiatrist or psychologist, but when a regular family doctor or regular family nurses will find these people, they will refer them who will help them.
Yeah, and I want to also add that these shortages is mostly on the eastern and central regions of Ukraine, and our government also pay attention into this problem regarding the mental health, and the First Lady initiated like a national initiative on improving mental health services, and within this initiative also like basic mental health services were integrated into like package of services provided by primary health care providers, like family doctors.
Hi, so yeah, I just want to echo again, thank you for sharing all your experience today. That was a really great presentation, so thank you. I had a question actually about the sort of the infrastructure and how the health system is responding to the attacks on the electrical grid. And in particular, I know health facilities all around the world are looking to try to make their facilities more resilient to electrical outages. I know there's concerns in the US about the grid going down. I was actually just in Mozambique, and they were talking about adopting a policy to put solar panels on all provincial hospitals. And it seems like Ukraine is dealing with really unique challenges around these outages around the country. So I'm just curious, how are the facilities trying to make themselves more resilient to those electrical outages? And I know in many places there are generators, but I imagine in a conflict setting, access to fuel might be a challenge. So I don't know if you have any experience around that.
Какие решения для этой проблемы осуществляются? Я знаю, что у них это большая проблема, есть, например, отключка электричества.
Ну, ми маємо вже другий рік війни, маємо досвід. Блекаут у нас минула зима, ми провели в холоді і в темряві.
not always be able to solve this problem. It was very harsh winter. And we was in the darkness and we was in cold.
Е, 2 дні тому, 2 дні назад, я мала розмову з головним лікарем Криворізького центру СНІДу.
2 days ago, I spoke with head of hospital in Kryvyi Rog.
Вже перебуваючи тут в Америці, ми почули, що там було масивне бомбардування, про яке Альона говорила, і місто в блекауті, там зовсім немає електроенергії.
And when we already here we heard that in the Kryvyi Rih, they have blackouts in whole city, not only in hospitals.
Ми завжди цікавимося, як справи у партнерів. Ну, для України це зараз таке життя. Ми один в одного питаємо, якщо в якомусь регіоні там було бомбардування, ми обов'язково зідзвонюємось і питаємо, як справи.
То есть, когда это случается, мы
Да.
So we have a good connections between different regions in Ukraine. So if one region have a massive attack, doctors from the different hospitals in the different regions connect this head of the hospitals. So basically, we contact the hospitals, head of the hospitals, what problems they have, what needs they have in the place where was massive attack or blackouts or any other problems. So we don't leaving them alone. We try to find out what needs they have.
Я, будучи вже тут в Сіетлі, зателефонувала в Кривий Ріг.
When I find out that in Kryvyi Rih have a blackouts and blackouts, I already called them from US and spoke with them.
Але, слава Богу, всі живі.
Thanks God, everyone still alive.
І медична система повністю працює на генераторі.
And medical system are functional and continue working on the generators.
Тобто об'єм послуг не знизився. Ну, тобто услуг не
So they are providing all services as needed.
But also, as Oksana already told that the previous winter was really horrible regarding the blackouts. We had different regions of Ukraine constantly had blackouts, and it would take not days but weeks. And of course, it made people to care about them, and not only healthcare facilities, but everyone tried to buy generator. Even a small cafe, they also have a generator of electricity. And of course, as I already told that about 50% of Ukrainian capacity to generate the electricity was blocked, and also European countries help us. They share electricity with those regions who experience lack. But the previous winter, many of European and American funds helped Ukrainian healthcare facilities to receive generators for provision services.
Is there time for one more? Okay. Yeah, thanks. Alyona, you alluded to the real heroism of the health workers, and Pam was asking about these different service delivery models as
they're trying to keep the continuity of services even in this terrible situation. You mentioned for example, the model where maybe the doctor is in a different part of the country and on the phone with the nurse who's then with the patient. And I know Ukraine is quite a formal country in terms of regulations and, abiding by the standard protocols and legislative framework and regulations. And I wondered if these adaptations, if they remain kind of informal, or if there have been kind of changes like around scope of practice or around what's kind of formally recognized and approved around these models of care.
Thanks, Nancy, for your question. Mostly this is not like in line with legislation. Actually, war is not in line with legislation. And if there is a chance to provide services, our doctor will do this and find the way how to do. I would like to give maybe a very short example. Maybe some of you has seen the documentary 20 Days in Mariupol. And you could understand the circumstances in what the people and clinicians were there. For instance, our colleagues from AIDS Center, until they during maybe 20th of March, they stayed in the city without electricity, without internet connection, but they continued to provide services. They tried to negotiate through friends, through another clients with their patients, and let them know where they can receive drugs, because AIDS Center is located very close to front line. During all this like 10 years of war, they all the time could hear the shooting at the front line. That is why the AIDS Center was targeted very fast when invasion started, and they removed like drugs tests to other part of the facility. Yeah, but when they did so, she wrote also on the door her phone number where she is planning to go. She planned to move to Rivno region for another region, and she said like, please connect me and I will help you. If you evacuate, I will help you to find physician wherever you would be, like in different regions. So we have a really good connection between clinicians, between also CPH helped, and our project tried to support and keep this linkage between the patients and clinicians. Yeah, but of course, no, these like hybrid models are not meets all requirements that are listed in the legislation.
I'm actually curious to know, having, worked firsthand myself with the iTech Ukraine team, if you would be comfortable sharing some of the strategies the team and iTech Ukraine staff have used themselves to bolster their own resilience to keep the work moving forward in such an impressive way when you're spread all over and you have massive disruption to your own lives.
у нас, напевно, немає вибору.
We have no choice. Not so many choices. Only
Ми живі, ми боремось, ми
We-
працюємо.
we still alive, we still fighting, we still
Поділитися якимось своїм
is trying to survive and to help survive to others.
Я пам'ятаю нашу команду, коли Київ був під загрозою окупації, коли були вже артилерійські обстріли, так поряд була ця лінія фронту.
I remember our team when it was under
Київ.
in Kiev.
Київ.
In Kiev,
Коли ми не знали, це наша держава, чи це вже інша, чи нас захопили, чи ні.
we have no idea. This is our soldiers. This is Russian soldiers. We have no idea who. It.
Але ми знали, що ми не будемо захоплені, поки ми є, ми боремось. І
But we already know for sure we never will be closed. We will still working. We have a goal, continue work. To work.
у нас багато членів нашої команди пережило окупацію, не багато, двоє молодих красивих дівчат. Про Ірпінь, напевно, ви чули, що там було?
Two beautiful girls from our team was in occupied territory.
Ірпінь.
Irpin.
Ірпінь, де мародерство, насилля, катування цивільних.
It was a lot of violence in this area, like lot of raping, stealing, lot of violence.
І там були наші дівчата.
And our girls was in this area.
Альона, яка вона сама скаже.
Alyona will tell you.
Да,
Own
ми
story.
всі розумієте, коли ми трималися команди, ми один одного не впускали із виду.
We try to keep eyes on each other.
Не було зв'язку, не було можливості спілкування онлайн.
We have lack of connection. We have lack of internet. Telephone. We have lack of connections by phone, lack of connections with internet with each other, but we still keep eyes on each other other ways.
Ми згадали старі комунікації, коли можна прийти один до одного.
We basically use the old way of communication with each other. We just basically go straight to each other houses.
Київ – це багатомільйонне місто, щоб прийти – це кілометри.
And because Kiev is a huge city, it's like a lot of miles between one home to another home.
Поступово команда оговталась, команда згуртувалась.
And our team still be together. Keep, Mr.
Сплотилась.
Our team became, despite all these difficulties, our team became more close to each other, like one.
І коли ми відчували особисті ці всі трагедії на фоні війни в Києві, ми були ще відповідальними за тих людей, які в регіонах і яким було, можливо, гірше, ніж нам, наші партнери.
Так, то есть вы все равно могли работать и оказывать помощь партнерам, другим
понимали,
что
Ми ж знали, що їм ще гірше, ніж нам.
And despite,
Мали й той
of
зв'язок.
course, when we experienced all these difficulties in Kiev, we realized that our partners in different regions have even more difficult time than we are.
Коли дзвонили партнери з Чернігова і говорили, ну ми не знаємо, завтра будемо жити, не будемо.
Our partners from Chernihiv area called us and told us, we have no idea, we will alive tomorrow or we will be dead tomorrow.
І говорили, допоможіть, нам треба препарати, в нас хворі, ну, немає доступу, немає поставок, чи можете ви допомогти?
And they ask us to help them because we don't have, they told us, we don't have enough medicine, we don't have enough prep. Please help us because otherwise we don't know how to help our patients.
І ми бачили цю самоотверженість в цих прифронтових. На початку війни був зв'язок з окупованими сайтами.
And we saw how our heroes work on the front line, around front line, in the areas of front line.
Зараз ми бережемо ці стосунки в команді. Бережемо отношения в команді.
Our relationship between our team just became much better. We became friends with each other and it's only make us more team.
Ми стали частіше зустрічатися, і на стаф-мітингах ми обов'язково обговорюємо особисті проблеми.
After that happened, problem with communications, like telephones and internet, we started to see each other more often. Our meetings became more often and we discuss everything what everyone knows around, what news around, basically.
Кожного разу після цих жахливих обстрілів по Києву або по інших регіонах, де ми знаємо, живуть люди з нашої команди.
When we know that some regions have a missile attack, and we know in these cities living people from our team,
ми обов'язково після цього що ми чуємо кожного члена команди, кожен повинен сказати, що да, я живий.
We try to find out if our team is still alive, how they doing, and if they have need any help, if they have any needs, and how we can help them.
То на фоні цього життя робота – це задоволення. На фоні такої житті робота –
if compare that kind of life, our work became just even more enjoyable.
Actually, and I want to add that personally for me, because first days of full-scale invasion, I was in my parents' house with all of relatives, about 15 people, 4 dogs, 3 cats, everyone picked there, yeah. And the small things help to keep mental health in a good position. I mean, like cooking and care about others, because we was like, my parents' house is about 6 miles from Bucha, and where the active explosions and combats and fightings happened. So we heard all the time that, and war plan was under all the time run under about our house. But when then in 10 days we decided to move because we heard the shooting on the streets, so it came closer and closer, and we, with my husband and brother with his family, we evacuated parents' state because my father said, I will not go anywhere, it is my house, I built it and I will fight for that. And what really gave me a new like a breathe. It was actually work. When we moved to Ivano-Frankivsk, it's on west of Ukraine, and I have a rest for maybe 1-2 days, and I said myself, oh my God, I have still have work. And people still provide services in the regions, and we have to support them. Yeah, and we kept, as Oksana said, like started to conduct what we generally conduct, like monitor. I requested data extraction from the HMEMS just to see how is the things going on, and who collect data, who do not. We saw that if facility do not enter anything into HMEMS system, that means that they do not have electricity, because during the first weeks of war, there issues with electricity and internet connection everywhere, and that is why sometimes we had like to wait maybe a day to connect with somebody, or just message and just hope that sometime this person will receive messages and respond. Yeah, the work actually helped me to stay strong. Yeah. I saw that you.
Yes, thank you all so much, first of all. And I'm just wondering if there's anything that us in this room or people in the United States can do to support iTech Ukraine's work or Ukraine more widely.
Или вообще в целом в Соединенных Штатах могут помочь и IT, и отлично.
Actually, we need weapons, so we need support. Yeah. Our defenders will do, they do incredible work, and they are heroes. And actually, I'm very proud that such smart, brave people defend Ukraine. So this is the best of our generation right now. They are stay at the front line. We lose a lot, lose the best members of our generation. Yeah, but we have to resist. We have to fight, and we have to protect, and we need victory. Because there is no option for us to live under occupation or under Russian occupation, because actually it already happened in previous century. If you would like to learn more, you can dive deeper into our history. That time they occupied us, and made horrible things in Ukrainian territory. It's like a Holodomor, and all repression of people, murders of those who wanted to identify them as Ukrainian. Now we have to resist, and actually, there is no space for impunity of violence of international law. So nobody can violate international law, and that's why we really hope to receive support. Yeah, and
I will say also, back in the start of the war, thank you, Alyona and Oksana, but at the start of the war, we established an iTech humanitarian fund, and you can find that on our website. And we received, through the UW as well, we received quite a lot of funds, and that initial tranche of money went toward a local organization called Helios, and they supported a women and children's shelter. And initially those funds went to outfit that shelter. So basically sort of internet safety and security for that shelter. And it was targeted for women and children that suffered from sexual abuse due to war. They're still active, the shelter's still running. And our hope was to, if additional funds were to come, more funds, is potentially support some of the mental health work that they're doing at that shelter. So that's an opportunity. I mean, I know there are many, many others, but that is a way to support, peripherally support the work that we're doing. So at ITech and Elios, if you're interested, Elios is a great partner as well. And has worked closely with you all.
Yeah, and actually they helped a lot of women who suffered from sexual violence. And this is like sexual violence unfortunately increased drastically on the occupied territories. Yes. And yeah, thanks for that funds and for the support of Elios.
Фонди для поддержания этих всех жертв насилия.
Are there any other questions? I don't see many questions coming in online. I'm just going to put in the chat right now a link to an article that we did about Elios and the work that we did there in case anybody wants to know more. And there's also more information about that particular organization that supports a lot of different causes throughout Ukraine.
Yeah. Yeah.
I guess if there are no other questions or any other things that you would like to share with the group, I'll allow you to have the last word before we close the meeting. And people, there are cookies and coffee here too, if you
собранию. И если хотите, можете угоститься, там есть вкусняшки.
Ну, перед вкусняшками, я думаю, ми безмежно дякуємо американському народу, ми дякуємо людям, які тут в залі, тому що, напевно, да, добре ці всі грошова підтримка зброєю, це для нас життєво необхідно, але ми повинні знати, що кожен з них, що в нас тут є люди, які наші однодумці, які не піддались на там брехливі різні там меседжі, які думають так, як ми, які підтримують нас. Ми їм дуже дякуємо.
First of all, we are very thankful for whole American nation, for people who sitting in this room, for everyone who thinking the same way as we do, for everyone who doesn't affected by other propaganda and believe only us. And we very thankful for all your supports with weapons, with helping to us to fight.
І наша перемога в Україні, вона стане спільною перемогою. Демократії, цивілізації і взагалі чогось доброго і хорошого на цій землі.
We believe in our victory, and we believe in victory of democracy in Ukraine, and everything good what can be along with democracy.
And also, we would like to thank to each of our colleagues from headquarters for your constant support, for staying with each of our team members, for worries, and all the time you ask, how are you doing? And this is very important for us, and thank you very much. Yeah.
So basically,
It's
for
a pleasure to work
emotional
with-
support, it's also big deal for us. Emotional support and understand.
And it's a pleasure to work with all of you.
Yeah, and thanks everyone for coming today. Thanks for your interest to Ukraine and the current hard situation related to war. Thanks.